Okay, thank you very much. Thank you very much. First of all, I'd like to thank the management of Elkan. They have a wonderful team. I think they deserve a round of applause. Thank you very much, Mr. Samuel, for making this possible and inviting me through Miss Kate. I'd like to thank the group of Miss Jin Hee. And this gentleman ran for the Senate. He asked me, go outside of the Philippines, look for countries that are offering nutrition, and when you come back, use it as part of your treatment. I have never regretted that day. Because I know a person who has some more weapon to prevent or treat the root cause of the problem is better off than a patient who only has symptomatic treatment. Now, this is the nice thing about the Philippines. 20 years ago, this senator, who was a former Secretary of Health, has only one law that was passed. And that law is in effect until now. We call it the Traditional and Alternative Medicine Law. It requires graduate doctors of the Philippines to consider in our prescription the addition of nutrition with the other medication. Sadly, not everybody follows, especially the older generations. And I believe it is true as well in Malaysia and in many other countries also. Correct? Correct. But Dr. Flavier, the name of my mentor, has some other ways to help the patients. We went into media. We went into radio broadcasting, which later on became a television show. And later on, he passed away a few years ago, but I continued his legacy, going into the rounds of the media, going to different countries to talk about the law of our country on natural medicine. Now, 80% of my practice, because we have a very high incidence in the Philippines, maybe because we follow Western diet, is made up of cancer. Of the 80%, a majority of it is called malignant. That means the patient has a terminal case. When we say terminal case, normally the other doctors like to give a life sentence of about 5 years. When a person is said, oh, you only have 5 years to live, of course, no one is willing to accept that because that's painful. A person will always look for something to help them. So, if you take a look at the slide, the recognized clinical management in the Philippines, as well as in the other parts of the world, is still the three things. To do the surgery, to cut it. After they cut it, they inject you or give you medication to poison the cells that they were not able to cut. And to further aggravate things, they burn it using radiation. I have nothing against it. In fact, I co-manage patients undergoing the three treatments: surgery, chemotherapy, and radiotherapy. But this is where the problem lies. Those three is aimed at killing only the cancer cells, but at the same time, it destroys the normal cells. That's why patients go bald. That's why patients lose their appetite. They get pale, they get very thin, they get very weak, and many succumb not to the cancer, but to the treatment itself. If only the doctors would have given something to improve the immune system of the person. And that is why we are lucky. Today, you're going to learn about it. You're going to see my actual cases. Patients who believed in it, and patients who are better off now than before, and better off than many of their colleagues in the hospital who have passed on and they are still living. So right now, there are the new doctors like me that was trained by Dr. Flavier who are willing to try products that will give quality of life. That is a keyword that I wish you to remember and repeat. We are not always going to promise a cure, but we can offer a QOL, a quality of life. and a scientific way to improve their health. We cannot say cancer is a death warrant. No. This is where integrative medicine, some people call it natural medicine, some people call it nutritional medicine, will come into play. This is your role. Maybe some of you are doctors, maybe some of you are into nutrition, but the reason I am willing to give talks like this is because so that I can reach out to people who are exposed to 10, 20, 50, or 100 people. Some of those are suffering from terminal illnesses. If you take a look at this, CAM, as you can see in the slide, means complementary and alternative medicine. That means anything that is in addition to their usual traditional prescription, if added to a patient, if you take a look at the arrow, there is an expected improve in the quality of life. And on the third arrow, or the second arrow, you see an expected boosted immune system. When we say quality of life, what do we mean? We mean the person feels more energetic. That goes away when someone has cancer. Later on, the person develops depression, cannot sleep, they have anxiety, cannot eat, and their life is miserable. Those surrounding the cancer patient, their life as well becomes miserable because he or she is irritable. When we add something to boost the immune system, the person feels energetic. The person is able to eat. The person will be able to sleep. And there is less pain. So while the other medication works its way, by boosting the immune system, there is improvement in the quality of life. So this is quality of life. And what is true now may be untrue in the future. But what is always basic when patients or people ask me, Doctor, what do you suggest for people who suffer from chronic, degenerative, or cancer cases? Go back to basic. Simple life means simple meal. To slow down, our pace is too fast. To have peace of mind, not to worry about things that we cannot change. To always be grateful. And to take something that you believe in, which you know is natural, organic, and has been researched, is evidence-based, approved by scientists all over the world. The medicine of the future is really called pharmaconutrition. That means the use of nutritional medicine, whether we believe it or not now, or whether our doctors believe it or not now, together with the usual surgery, radiation, and chemotherapy, would be immunotherapy. And that is the future. Nothing can actually claim, not surgery, chemotherapy, or radiotherapy, say it's a guaranteed cure for cancer. Right now, the only thing that can cure cancer, like the lady who gave a testimonial, is our own body. Our body produces what is needed to fight off cancer cells, as long as we provide the precursor, the ingredient, so that it can produce the two kinds of cell, the T and the B cell. And the T and the B cells will produce our own natural killer cells. There is a lady who traveled 8 hours by bus from the northern part of the Philippines to reach my clinic in the city, and she traveled in the evening taking a bus by about 9 or 10 p.m. so that she can reach my clinic at about 8 a.m. She was diagnosed to have one of the most deadly kind of cancer. It is cancer of the pancreas. Many of you know where the pancreas is. It is in the middle of the abdomen. Surrounding it is the small intestine called the duodenum. On top of it is the stomach. And on the right side of it is the liver. And underneath that is the gallbladder. When the pancreas is big, is huge, is inflamed, it blocks all of those things. It blocks the stomach, the duodenum or the intestine, the liver, and the gallbladder. So what will happen to the patient? She will be yellow. Jaundiced, we call it. This is her picture, or rather this is her case. She has abdominal pain. I did a laboratory test called CRP to check if there is an inflammation ongoing. Of course, I knew that, but just for documentation, I saw that it was elevated. There is a mass that I can feel. She has a very big abdomen. She's yellow, and she cannot breathe properly. Pancreatic cancer is one of the deadliest cancer, and normally patients with this are given 1 to 2 years to live. I saw her just last month, and we've been going steady for 5 years. I saw her last month so that I could sign a waiver that I am allowing her to travel by plane to Canada to visit her family. She brought me back chocolates. So the payment for doing this job is not only monetary. It's not only about chocolates. It's the smile. It's the satisfaction that you really did good. We share that to all of you.